and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I want to thank everybody in attendance for the meeting tonight. As you can see, Ron is absent, so his absentee person is me, Therese Lees. I've been the mayor pro tem for a couple of years. And so, we'll have a roll call, please.
Covert.
Here.
Crowner.
Here.
Johnson.
Here.
Lees.
Here.
Young.
Here. Okay. And then on the agenda, under the consent agenda, I would like to pull item number 5.
So moved.
Support. Motion with support. All those in favor?
Aye.
And then I need someone to approve the consent agenda, which is items 1 through, well, there's 5 items now. The minutes from the regular meeting on August 27th, minutes from the regular meeting on September 3rd, the clerk's monthly treasury report for July and for August. And then we have the expense approval for $212,367.58.
So move that.
Support. Motion with support. All those in favor say aye.
Aye.
Motion approved. We can go to council and staff reports, but our city administrator is off gallivanting in Colorado, so we won't hear from him. He's going to the Garden of Gods, and I told him if he saw me out there, he could kiss my feet at the statue. We'll see if that happens. And bring me a snowball, because they do have snow up at Pikes Peak.
Yes, they do.
So with that, we'll go with Chase with Public Works.
We just finished up on the Alice Place sidewalk last week, and then also put in the new turn lane on Agency. So we still have a couple more signs we need to add to that, but both of those are pretty much done. And then next week or two, we'll just be working on replacing old fire hydrants that need replaced or broke or both. So that's what we'll be doing if you see us around town. So
Getting the snowplow equipment's ready to go.
we were just starting to think of that last week, actually. So ordering blades and stuff. So
Chase, have you talked to Greg or anybody about the ditch there at the park or the trail?
I have not.
You
I haven't got any direction on that. So.
Okay.
We'll go on to our police department with Chief Logan.
A couple things. Applications close next week for 2 open spots, and we've been monitoring the situation out on Agency. It's been going okay. We just continue, see how it goes. Fire Department, Fire Prevention Week is next week, or 2 weeks, excuse me, October 5th through October 11th. We'll be up to schools like we always are. Class interaction with the K through 5th graders, and then we'll do our fire drills and all that other with the high school and elementary school. So we're getting ready for that.
So when you said doing okay, has there been any accidents?
Nope,
Or been
no
any
accidents,
close-
just a couple traffic offenses. So just, people are confused, which is very understandable, but I think I sat out there on Monday, and it went pretty good on Monday out there, so.
Anything from finance, my dear?
I talked to Dave at the auditors, and he said I'll have the audit draft by the end of the week.
Kelly?
Not tonight.
I guess we'll start with council reports. Melanie, you want to start us off?
Oh, yeah, thanks. Last week I attended the Iowa League of Cities Conference up in Des Moines, and that was time very well spent, both with team building with the fellow folks from West Burlington who went. 5 staff people, Katie, Angie, Kelly, Greg, and Ron Teeter also went. And if nothing else, attending conferences like that allows for networking with other communities and seeing the challenge, hearing about the challenges other communities are having and then how they're addressing them. And it's well worth the time spent. Additionally, it's also interesting to see the vendors and all the support vendors for the whole business of government, for city government. It's a chance to talk to many of them and see what they bring to the table, and cause me to think about how we spend our money differently and who's all out there. So anyway, time well spent. I attended conferences on housing, CIP, now what, and housing is a statewide problem. But some neat things out there we might be able to consider. Can't wait till Greg gets back and can go over some of that stuff with us. And then, of course, got a bike ride in Des Moines, and got a pre-soak. In other words, we got rained on pretty good, but it was a good time. And a couple good walks that involved team building with the folks from Burlington and one being Chad. So anyway, good conference. Chase, thanks for getting the sidewalk done in front of Alice's place. I'm here to report that you can now walk from Gear Avenue to Walmart and not cross a street. It's pretty good for those folks who walk. Think of that. All the way from Gear Avenue to one of the major retail places. Not the most direct route, but pretty darn close. And a lot of people live along there. That's along where our school is. That's where Alice Place is. So thanks, Chase, for getting that done. Appreciate it. And lastly, I think the Walmart exit looks great. Driving out through there, it's like, makes sense. Well done. Thank you.
John?
There was supposed to be a hit on the stop sign out at the railroad tracks. I don't see it on this week's agenda, but Greg said it was going to be. I was going to, Chief, he said you knew something about that he had talked to you about that?
Yeah, we have to do some talking with railroad and see what we can do to get that put up there. So we got to do some background on that portion of it before we put one up out there.
So that's probably why it's not on the agenda.
That's why it's not on the agenda.
Okay. Besides that, no, I don't have anything else.
Thank you. Andy?
Just a quick Chase question. Your fire hydrant brought this up. Has anybody mentioned to you on Lane Drive about painting those out that direction?
Yeah.
Okay, as long as it's on the list. That's all, thank you.
And the birthday boy, Ringo.
Oh, hey. Yeah. Can't see my hair's going gray, but. I want to recognize a person who just recently passed away in our community. Her name is Linda Long, and she helped on the 4th of July celebrations, and she was also an avid supporter of SOF for the military. That's how I got to meet her in early 2000s when my son went over to Iraq, and she reached out, and there's a lot of people who do not know that she helped organize gift boxes for the veterans that were over there. And she's just an amazing person, and she's going to be missed, and I wish her condolences to her family.
Okay. And I don't have anything, so we'll go to our community reports, and I see we were honored to have Dr. Michael McCoy, the CEO of Southeast Iowa Regional Medical Center, where I was employed gainfully for 45 years before they thought I needed to retire. So if you would step up and identify yourself, that I've already done for you.
Thank you, Teresa. And Teresa used to have me refer to her as captain or colonel or something. That never a high enough rank that I called her, but I tried. I appreciate your time and on your agenda at this meeting. I'm Michael McCoy. I'm the CEO of Great River Health Systems, and I'd like to take about 10 minutes or so to just give you a Great River Health System update. Thank you for your time, and any questions after my comments if there's the time that allows. I'd like to cover kind of 3 topics. I'd like to give you just a little bit of a general health system update. I'd like to talk to you about whatever you're calling it today, OB3 or One Big Beautiful Bill. I call it HR1. HR1 is a tax bill that I would like to share with a little bit about how that could affect rural health care. And then just finishing up with one of the biggest projects our health system as a system has ever done and is ongoing is a transformation to a new electronic health record called Epic. From a general health system update, we as a health system now have, we have 3 hospital campuses. We have several clinics across southeast Iowa. Great River Medical Center and Fort Mass Community Hospital affiliated back in 2018. And then on July 1st of 2021, we formed a Soul Community Hospital, which is a CMS designation that sort of helps rural hospitals try to get paid better for Medicaid and Medicare services. And at that time, on July 1st, we brought Cerner as an integrated health record and had Fort Madison Hospital join with that. So then we had one hospital with 2 campuses. And then also on July 1st, we took Henry County Health Center, which was the Soldiers and Sailors Hospital for over 100 years. And based on a 347 code in the Iowa Code, we got a long-term lease on that hospital to have a critical access hospital in the health system, which is very important if you're trying to sort of form a health system and be independent and be sustainable. Then in October of 2023, we put the entire health system in the region on Cerner and Workday. So we're on the same application for both our electronic health record, supply chain, human resources, et cetera. We have 5 rural health clinics in Keokuk, Mount Pleasant, New London, Wapello, and Winfield, and then we have also health clinics in West Burlington and Fort Madison. We're the largest employer in the region by numbers and by economic impact. We have over 2,800 employees currently, which represent over 2,200 FTEs. We have right at 200 providers that are employed, many more that are also then on the medical staff. 55% of those are physicians, and 45% of those are APPs, or advanced practice professionals. That would include PAs, nurse practitioners, and CRNAs. The health system then supports through IHA data over 4,500 total jobs in the 3-county region. We pay over $300 million in wages and have over $30 million in community benefits that we're responsible for each year. And we generate approximately 28% of the region's gross domestic product. In 2023, then, with adding Henry County Health Center, we had a systemized structure. We brought on Cerner as an integrated health record and Workday, as I mentioned. And now we have service line department structure with transfer of our patients within our system first, based on acuity and capacity. And we have the sharing of staff at times when appropriate. Right now, our hospitals are doing very well with the number of patients. We're pretty much full out at the West Burlington campus every day. This morning we had 7 patients that were boarding in our emergency department because we didn't have beds. And that's not just beds. We staff all the beds, we just don't have any more beds. We're doing a major emphasis on quality and safety of the care that we're giving. We have invested in real-time accurate quality and cost accounting, data acquisition, and we partnered with the country's largest healthcare performance improvement company to help improve quality, try to reduce our costs, and enhance the patient's outcomes. We've encouraged our employees and set an expectation of our 170 leaders to be involved in our communities. Our employee engagement scores have improved markedly over the last 2 years, as has our employee retention. Each of our hospital campuses are doing very well. We are strengthening our West Burlington campus to be a stronger regional referral center. We are improving access to primary and specialty care. Recruiting continues to be a major challenge for us. Iowa is 44th in the nation in the number of physicians per capita, and we're 51st, because we're counting Puerto Rico in this, of the number of OB-GYNs per capita in the nation. Our Fort Madison campus used to have a census that ran between 5 and 7 inpatients. The last census I saw yesterday was, I think, 27. We now average 20 to 30, with our ED visits nearly doubled to 45 to 55 since the closure of the Keokuk Hospital. The Henry County campus has had increased census. They used to average at Henry County a census of 2 to 3. Now there's averaging 7 to 10. We're working on staffing to increase that to 10 to 15. There's been a lot of remodeling and updating of the various areas of that campus with the clinics, gift shops, entry, and Henry County has gone from a hospital that had a negative operating margin to now a hospital that has a positive operating margin. and we are working very hard to make progress towards that goal for Southeast Iowa Regional Medical Center and the health system in general. I would just like to share a little bit of a statement around H.R. 1. The recent signing of H.R. 1, otherwise known as the One Big Beautiful Bill Act, has prompted questions about what this means for Great River Health and the communities we serve. This legislation represents a significant shift in how rural health care is supported at the national level. We are concerned about the projected reduction in federal Medicaid spending and funding resulting from the enactment of this bill. But we are thankful for the ongoing and productive conversations we are having with our elected officials. Medicaid is a critical lifeline for many of our patients and a foundational piece of our ability to deliver care in a rural setting. Great River Health in our 7-county primary and secondary market area has over 36,000 Medicaid members, and more than 15,000 of those are children. Any decrease in funding puts additional pressure on our already thin or negative margins and could impact services over time. Fortunately, these changes are not due to take effect until 2028. We appreciate the work that our congressional delegation did to secure this delay in implementation of the changes, as well as the $50 billion in Rural Health Transformation Program funds. This delayed implementation will provide more time to better understand how the Transformation Program funds, which will go to the state, not the hospitals, will help mitigate the upcoming changes to the directed payment program. We're actively participating in conversations with state and federal partners to better understand the full impact. What is clear is that the implementation will be complex and will require careful monitoring in the months and years ahead. As we learn more about the full impact of these changes, we will continue working with our elected officials. This may include discussing potential changes to what was passed this year once we know more. Our mission remains unchanged: to provide high-quality, accessible care for our patients and our communities. It is our obligation, both morally and contractually, to care for individuals without insurance or the ability to pay. We are committed to advocating for sustainable solutions that protect access to care, especially those most in need. We are committed to navigating these changes thoughtfully and responsibly. I'd just like to finish up with a little bit about Epic. Epic is we're now in the process of conversion of our electronic medical record from Cerner, now called Oracle, to Epic. This is the largest project ever done as a health system. This is a major investment in our IT infrastructure. We began pre-implementation work in the spring of 2024. We had a kickoff of the implementation phase that started July 8th of this year, and our go-live date will be June 6th of 2026. This will provide patients with more control over scheduling, billing, their medical record access, communication with care teams via access to MyChart. This will enable us to offer a better patient and end-user experience. It will allow better communication and better patient care, and it will support us better regarding our financial success. We will be able to offer better care through streamlined operations, a technology platform that will allow AI to work with our clinical and clinical support staff to help them be more efficient, help automate what we can so that our staff and providers have more time where it's needed. I'm glad to address any questions if time allows.
Dr. McCoy, it would be, first, thank you for being here and sharing this information. And those budget concerns are of great concern to all of us, as in the end we end up paying for those. I want to share a concern that I have with you.
Sure.
Obviously, in the past few years, the campus here has now paid greatly reduced taxes into the city. You're also a big user of our services. And so it's hard for me to sit up here and balance this budget every year when I have one of our biggest users not paying in compared to all the other users of our services. And I don't know ways that we have to change that formula yet, but I'd sure like to start a conversation about how we can fix some of this. I don't know how we can continue to provide the fire and police services that we do today to the level that we do today without having people that are using the services paying their fair share for them.
Well, if you'd like to have that discussion in this setting, I'll try to address it. What you're asking for is a pilot, a payment in lieu of taxes is what I assume you're asking.
I think a
because based on
conversation first.
Well, I will share, what we're doing is we're paying our taxes based on the law, based on what is tax exempt and what is not. And so I think what I'm hearing from you is you're asking us to pay taxes in lieu of that, what the law states we should do. Number one, I will tell you, if we can get our health system to a positive margin, that would be an interesting, fun conversation to have, because we want to be good neighbors. We appreciate the collegiality we have, and we appreciate the help we get from you when we need it, because we do need it. There's workplace violence going on. There's a lot of things happening out at the health system. Our staff are dealing with things that they shouldn't have to deal with, just like the police department probably is. We attempted to offer a payment in lieu of taxes discussion prior to the change of our organization and the tax exemptions. We're paying the taxes that we are supposed to pay. We're paying taxes on the properties that are not tax exempt. We had a discussion around doing that very thing, and those things didn't move forward. And if you want to have a discussion at some point about why they didn't move forward, that's probably a better place to do that. But we offered that very same thing.
And obviously, that a lot of that goes through the county and not through us, but yet it impacts us. I think part of the discussion I'd like to have, or at least you have with our staff, is more around maybe there's things you can change in security and things like that would reduce some of our police calls out there. I think there's discussions that can be had outside of money about different ways the campus could do things. Absolutely,
Mr. Crowner. If there are things we can do to be a great neighbor and a partner, we want to do that. We have added 24-hour security with Permar at our campus. We put it at the other two campuses, not 24/7 at both of them, but campuses that never had security before. Just based on some of the things you're saying, the things that our staff are putting up with and the things we're seeing. So if there are, and I think we've had a good relationship with our emergency management services, and I think they're having regular meetings, I think, with police and the law enforcement. But if there are things that in your minds that we could do, or you have suggestions for us, I'd be glad to try to pass those along or have discussions around that, because absolutely, if there are things that we can do to be a better neighbor in this area, I'd love to try to do that.
I'd sure appreciate that getting on a list somewhere, because I think we can solve things without just paying extra money. I think there's ways to help fix some of our budget issues.
Mr. Logan, if you have ways or ideas around that, I could get with you to try to find out how we could have those discussions.
Absolutely.
For sure.
I'd appreciate that, sir, talking to Chief Logan about the security. I was an officer for 20 years and been responding to that hospital many times. And when you're talking security, I'm sure Chief Logan would agree that some better changes could be enhanced where we wouldn't have to be less responsive and the appropriate people there. So I'd appreciate if you would make an effort to make that appointment with Chief Logan.
Yeah, I certainly think we've had discussions around wanting to call the police force for things that are appropriate and not for things that are not appropriate. And but yeah, I would be glad to try to help encourage the discussions around how we could do that better.
Or helping the police when they respond with information without them having to go around things to expedite the investigation to make it proper.
Yeah, if there are some specifics we could talk about in a setting to try to do that, absolutely.
Thank you.
Yep.
I think a lot of the policies we have are directed to our staff by our compliance and legal team, so they do their best to try to follow those policies. Now, if there's things that we're not doing following those, or there's things that you'd like to suggest could be changes to the policies we have, then those could be discussions that we could get the appropriate people for to do, absolutely.
Yeah, we need some help in balancing our side of this too, and so we appreciate any anything you can bring to the table to help this would be greatly appreciated.
Absolutely. So if whoever, Mr. Logan, if you could get in touch with me, I'll give you my contact information afterwards.
Thank you, sir.
We can do that.
Thank you.
Okay.
Dr. McCoy, I just want to comment on the movement to My Chart and Epic by Great River Southeast Iowa Medical Center. I appreciate that move. I know it's going to be painful, and people are suffering that pain right now as any big transitions. But having worked with My Chart with family members through Gunderson at the University of Iowa or Mayo Clinic, it's a step. It's a great improvement. So while it's painful to get there, hopefully a year from now we'll be singing the praises, and I just encourage your staff to fight through it.
Thank you, Michelle. You know, I felt sorry for our staff because we just had a platform that was never going to be able to allow us to give a patient experience like we should be able to. And they're trying their hardest, and we're not getting there. And probably half the people in this room have a My Chart, so they know what you're talking about. It's gonna be a much better patient experience for us, and it's gonna be a much better end user experience. And I'm really excited. So you're gonna be out there preaching about My Chart, and we're gonna really trying to get a majority of the public in the region signed up with My Chart and using it, because it's gonna be a much better thing. So thank you.
Dr. McCoy, just a quick question. So you mentioned that your full beds, your beds are all full.
This morning, our beds are full, and we had 7 people boarding in our emergency department.
So,
And it's not even respiratory season yet.
yeah. So I had a dear friend that's out there, and you know, she had to wait to find a room. So, you know, I know you're right. Are you short doctors?
Well, we staffing and workforce is a shortage across the country and in Iowa.
Sure.
And especially in some of rural Iowa. We have staffed beds. You know, back in COVID, we couldn't staff the beds, so we said we were out of staffed beds. Our beds are all full. And in our other campuses, they're full, because some of the patients in the past that would be a little higher acuity, and we would transfer those, say, to the University of Iowa or a higher acuity setting, those beds are not there. There's nowhere to send them. So we're taking care of patients sometimes at a higher acuity than what some of our staff are used to. We're sending patients back and forth between the West Burlington campus, Mount Pleasant, and Fort Madison, based on the acuity. Those hospital beds are fuller. And it's a real concern, because there's just not capacity in the region to transfer people when you want to transfer people. And it's not good care to try to take care of people in the emergency room when you're boarding them. But right now, at times, we don't have another choice. And when respiratory season comes, it's really sort of hard, because we're at capacity right now and above it. And so it's a concern for us in the whole region and the state.
I bet it is.
Yeah.
So my question, part of that was, are you short doctors?
So we are having struggles recruiting, especially some certain specialists. Right now, we're really needing 1 or 2 more cardiologists. That's probably our biggest concern right now. We're pretty good in primary care, but we're recruiting some specialists almost always. We have some coming. We have a urologist coming in a couple years. We have another one potentially coming. We have 2 new general surgeons that have just started. We are starting with a robotic Da Vinci robot here, because if you want to recruit surgeons now, they're all trained on it. If you don't have one, you can't recruit. That's just where we are. So we're not doing too bad. We're always looking for some more anesthesia help, and we're really looking for some specific specialists, yes.
Yeah. So how many traveling doctors do you have?
Our agency spend on traveling nurses, techs, and physicians, which locums we call, that varies. But I can tell you on agency spend, we spent $3.5 million last month just on agency spend, people that are not our own people.
Is it because we have a lack of nurses in this area?
We have, yes, nursing is one of our biggest workforce shortage areas, which is why we've really tried to partner with the SEC. We did a Rad Tech program. We just did 5 sponsorships to employ 5 of those students that are just graduating the first class this May. The second class, now we have first and second year class that just started. Our program with SEC is starting to help us, but those things take about 3 years before you start to see that. But, and this is across the state.
Yeah, it is.
There's just workforce shortage, and it's just not, it's not going to get better. So one of the big things that Epic's going to help us do is to use AI to help us do ambient, sort of virtual documentation, so we don't have our doctors and our nurses standing in front of a computer documenting. Documentation can be done in a different way, so they can be more hands-on and do more value-added care. And so we have to have AI help our current staff be more efficient and effective, because we're not ever, I don't think, going to have enough people like we would like to.
We have to go back to work, Teresa.
What was that?
What?
You may have to go back to work.
Oh, please, I don't know if I could deal with it.
He made me a cake and sent me out the door.
From a city side, with the fight, you're fighting with HR1, with the HR1 bill and trying to figure it out. Is there anything we can do from a city side?
You know, I think, I'm not sure that there is. A lot of this, there's a transformation fund that's going to the state through the Iowa Hospital Association. When I'm involved, and we're involved in trying to help the state get the application ready to do that. But right now, the payment you get for Medicaid patients doesn't cover the cost of taking care of Medicaid patients. And if that payment goes down, we're still going to take care of them. We just, eventually, what you will see across the state is you'll see services close, and you'll see hospitals close. We're not going to be one of those. At least, I have no concerns to that early on, but there are some hospitals that, the data shows that in Iowa right now, there are 18 hospitals at serious risk of closure in the next 2 to 3 years if this goes on unchanged.
One more quick question.
Yeah.
So, Keokuk, is there any in the future of a hospital out there? Because, you serve Missouri and Illinois. I mean, the next place is Quincy or...
Yeah. I visited about 2 or 3 weeks ago with the group that has the license for that hospital, the licensed bed. It's called Insight. They still have the vision of wanting to do what's called a REH, or a rural emergency hospital there. I'm going to be going down to Keokuk, I think, next month, and I'll try to update them as much as I can. I think they still want that, but I think they're waiting for funds to help get it started up, and I don't know if they're thinking maybe some transformational funds. They need some extra funds to do it, and I don't know if and when that's going to come. So otherwise, I don't know of anything more than that.
Thank you.
Yeah.
Well, I appreciate you taking the time out of your day to come and see me, or the rest of us.
It's always good to see you, Teresa. Thank you all.
Thanks for coming, appreciate it. And you don't have to stay for the rest of the meeting if you guys are done, unless if you're going to support.
I'm just going to want to make sure I can talk to you at some point.
I can meet with you.
All right. And it looks like we have a proclamation tonight for domestic violence awareness with Molly McKibben.
Hello.
Hi.
My name's Molly. I am the development coordinator. Are we supposed to sit? I don't know. Sorry. I'm the development coordinator with DVIP, RVAP, so Domestic Violence and Sexual Assault Crisis Services. We service Des Moines County, and October is Domestic Violence Awareness Month. And so we so appreciate you taking the time to observe it and on behalf of us and of course the victim survivors that we support in this area. I'm going to go ahead and read the proclamation, or is that okay?
You can do it or I can do it.
Okay.
If
Do you want to do it?
If you have practice, well, I have.
Oh, that's okay. I can do it. I can do it.
Okay, perfect. I'll just sign it.
Okay, that sounds like a plan. Okay, so the proclamation, Domestic Violence Awareness Month, October 2025. Whereas domestic violence, dating violence, and stalking affects people of all racial, cultural, and economic backgrounds, causing long-term physical, psychological, emotional harm, and whereas 1 in 3 Americans has witnessed an incident of domestic violence, and whereas children who experience domestic violence are at higher risk for failure in school, mental illness, substance abuse, suicide, and may choose violence as a way to solve problems later in life, and whereas domestic violence in rural communities exist as a hidden, silent, and often unrecognized crime that is often unreported, and whereas through the inspiration, courage, and persistence of victims of domestic violence, their children, and advocates, our communities are learning to recognize the impact of violence in the home and within intimate relationships, and whereas DVIP, RVAP, Domestic Violence and Sexual Assault Crisis Services, has worked to end violence in intimate relationships for more than 46 years through the collaborative partnerships of advocates, volunteers, local municipalities, criminal justice, health, human services, faith communities, business leaders, and private citizens. And whereas our community achievements should be commended, and we must continue our commitment to respect and support victims of domestic violence and to prevent future violence in our community. Now, therefore, it resolved that we, you lovely people of Des Moines County, do hereby proclaim the month of October 2025 to be Domestic Violence Awareness Month. So, and I forgot to have Jenny introduce herself. She is your guys' domestic violence advocate here. So, we have a lot of fun, not fun, but a lot of events, fun events, coming up for DVAM. So one of them is being Shot for Safety. So at local Hy-Vees and fairways in the area, we're going to be standing outside with lists of items needed for our transitional housing that we have in Burlington. So this is where we get about 6 months of our supplies. Our supplies are dwindling right now because it's that time. And so if you see us standing outside, feel free to grab a list and shop for safety, shop for our victim survivors.
Do you know the times when you're going to be at any businesses in the West Burlington or Burlington?
So I know, Shop for Safety will be October 8th, 3:30 to 6:30 p.m. We're going to have some displays at the local libraries, and then the proclamations. We are also hosting a fundraiser, if you guys have heard, it's kind of close by, Fat Jimmy's, down in Monroe, right? Montrose. So we're going to be doing a domestic violence afternoon fundraiser there. And then also in November, I believe we are going to be hosting a community night in Burlington for just to kind of come out and get to know us. We really want to establish ourselves here in the community, and that is part of the community engagement wise. So that is part of the reason I am here tonight.
So do you have a website for the specific dates and stuff?
I do, yes. So on the back of the thing that I gave you guys, there's a QR code that one of them is for the calendar, and then one of them is for the stuff, the needs we need for the transitional housing. So, all right. Yeah, and then there's also the stats. So last year in FY25, we served 341 victim survivors from Des Moines County, 3,100 hours, and 4,300 hours, and 3,100 services. So we're out here helping victim survivors, and we appreciate you guys recognizing that.
Do you know how these numbers compare year over year?
So actually I do, because I just wrote a grant. They are increasing. So I think last year we did about 2,500, a little over 2,500 total served, or maybe that was this year. They're increasing. I don't know the exacts right now, but there was nothing decreasing.
Ladies, I suggest you talk to Chief Logan too. Maybe you can put some of this information out when you have these events on the West Burlington Police Department site.
Oh, yeah, that would be super helpful. Be super helpful.
Thank you for doing this.
Yeah.
It's greatly appreciated. I know it's needed.
Yes, and Jenny, like I said, she's our local advocate here, so she lives down here, so it's a little bit easier. So I think it'd be really good for her to get with Mr. Logan as well.
Yes. I've popped out a couple of times, but I'm pretty busy most of the time, and I'm covering a couple extra counties right now too, so. But when things settle down, then I'll try to come out and make those connections and get some information for you, so.
And we hope to see you guys all at the event in Burlington in November. I think what we're gonna do is, it's gonna be at it's an art place, and we're gonna actually have youth from our shelter that are currently staying there. They're gonna draw some pictures, and we're gonna do like a little what we're thankful art gallery from these kiddos. So it'll be really fun. It'll be informational. We're gonna provide a lot of information about what we're doing for the community. I think it'll be November, I wanna say 13th is the day. It was like the Thursday before Thanksgiving, off the top of my head. So we have not released that out on socials yet. Yeah.
Well, here, I've signed your proclamation after you read it for me. I appreciate it.
Thank you guys so much.
Thank you. Thanks for coming.
Thank you. Appreciate it.
Thank you.
Thanks.
Oh, can we get a picture?
Of all of
Of
us,
all
or just
of
got,
you?
you bet.
Is that okay? Police chief, do you want to be in it too?
Yes.
Thank you. You don't have to be. Oh, yeah. You got it. Oh, I said it. Thank you. If you guys want to do the. Hold it up. There we go. 1, 2, 3. All right, got it.
Thank you so much.
Again, thank you guys. We appreciate it.
Well, moving right along, we have a public hearing on the plan, specs, and form of contract for the Mall Road resurfacing project. And I think we have Jesse here? Yep. That's great.
Jesse Howe with Hidden Prairie Engineering. Talked about this briefly a couple weeks back, but the project's for roughly 900 feet of resurfacing on the Mall Ring Road next to Alice Place, heading back to the entrance of the mall. I was made aware of a quantity bust that I had. I had inadvertently entered another zero where we had roughly a mile and a half of milling as opposed to 0.15 miles. So I'll have that corrected and out. So we have that in the documents. It would have resulted in about $1,500 worth of difference, but you only pay the contractors what they actually do. So appreciate you guys bringing that to my attention. Usually I'm a little bit of an Excel wizard, but hit an extra zero in there. The project really just calls for milling 2 inches off of that segment of roadway and then putting 2 inches of hot mix asphalt back in. Questions for me?
Jesse, with the project, do you see anything outstanding about it, or should this be pretty run-of-the-mill, 900 feet, take it off, clean it up?
It is pretty run-of-the-mill. The only thing you kind of have working against you is the size of the project. It's a smaller thing. So what we've done with the advertisement packet is given the contractor a pretty big window to try to work it in with other work in the area so that they can pair it with a bigger job, and it'll reduce your guys' cost at the end of the day if they can pair it with a larger job and mobilize their equipment in a way that isn't so expensive.
And the packets will have that correction?
Yes. Yep.
So when you add that extra time, it gives them a bigger window to get it done, which should give us a better price, but everything's going up, and so do they bid that at an anticipated price that they don't know about, which could really cost us more by doing it longer?
They're able to lock in their oil prices now. A lot of times when they get their commodities and things, they'll be able to lock it in for a certain window, and you're really probably looking at one of the asphalt producers as opposed to maybe a smaller firm, because you're going to need a pretty big milling machine to get in and do what you guys are looking to do. But no, I guess to answer your question more directly, they lock all their bid price in now.
But do they do that by a higher price 6 months from now? They do it at a price of today?
I don't know how long they're able to lock in their prices. I think it's usually 3 to 6 months, but they're able to lock it in with a lot of their oil suppliers, and they have oil on hand to mix into their asphalt a lot of the time. Our window is essentially now to May 1st, so it'll be their spring oil price that they're getting for this. But usually it doesn't fluctuate rapidly unless there's stuff going on in the Middle East or something like that.
And then with this contract, they can choose their own start date, and once they start, they have 30 days for completion.
Correct.
So they could wait until next spring.
Yeah. Yep. I don't anticipate it's going to take them 30 days. It's probably they're milling it one day and laying it a couple of days later, so.
Thank you.
All right. Thanks.
Council have any other questions? Did we have any comments from the public, Kelly? No. Okay. I'll close the public hearing. Since we don't have any old business other than John, we'll move on to new business. And item number 1 is to consider a resolution approving the plan specs and form of contract for the Ring Road.
Motion approved.
Motion with a second. Any other questions, concerns, or comments? Roll call, Kelly.
Crowner.
Aye.
Johnson.
Aye.
Lees.
Aye.
Young.
Aye.
Covert.
Aye.
Motion approved. Thank you for coming, Jesse. Item number 2 is consider support for the development of U.S. Highway 61 Corridor Public Engagement Plan and Preliminary Assessment.
Motion to approve?
Second.
Motion with a second. Any other questions, comments, concerns? It looks like it's a letter of support so that we can get our neighbors on the road, so to speak, or a new improved road. Okay. Roll call?
Johnson.
Aye.
Lees.
Aye.
Young.
Aye.
Covert.
Aye.
Crowner.
No.
Motion carried. Item number 3 is to approve a resolution accepting the street finance report for the fiscal year 24-25.
Your temporary honor, may I mention we have a couple folks here in chambers. I wasn't sure if they wanted to say anything on that last item or not. If you wanted to have a comment on that last item or not, or?
I was just going to review Taylor Collins, the Economic Development Director of the Partnership's letter with you.
If you'd come up to the microphone and...
I am Secretary Treasurer with the Highway 61 Coalition, so I've been involved with that group for some time.
What's your name, please?
Brenda Levitt.
Thank you, Brenda.
So I was just going to review the letter. It's in the packet, but I can certainly kind of walk through that. Currently, we have the support of the Highway 61 Coalition, Des Moines County, City of Burlington, to reconfigure the corridor and to hire Snyder and Associates, an engineering firm, to help us with a development of a plan, some public input meetings, and to talk to IDOT about the plan and kind of help us present that. If you have any questions, there will be a public input form that the public can put their inputs and comments on. You can find it on the partnership's website, on the homepage. If you scroll down to the bottom, there's a quick link, and then there's a Highway 61 website. You can look for more information there and a place to fill out that form. Next Monday, the 29th, from 5:30 to 7, we're going to have a public input meeting in the partnership's offices in the Weingard boardroom. Would love to have all of you there to attend, and West Burlington's support included with the other organizations I named. There will be a second input meeting after that first one because Snyder and Lance will come up with 3 plans after that they'll present then to be reviewed at that second input meeting. And at that point, they will present the coalition with a final plan and a presentation to take to the IDOT commissioners then in December. So I think December will be the time we're planning to meet with the commission. So we'd appreciate your support, or we appreciate your support, and we'd love to see you Monday night at the partnership for that public input meeting.
Thank you.
Looks like it's 5:37.
Yes. So, thank you.
Chad or John, do you have anything you'd like to add?
Thank you for your support. Yeah, thank you for your support, and we appreciate your willingness to work with us and help shape that corridor for the future.
Thank you, guys.
Thank you.
Appreciate it.
Thank you. And you don't have to stay for the rest of the meeting if you've got supper plans. You're out of here.
No offense, I get plenty of those.
All right. Going back to item number 3, to approve a resolution accepting the street finance report for fiscal year 24-25.
Motion to approve.
Support?
Motion with support. Angie, do you have anything you want to state about this?
No, this is something I do every year. Just reviews state thing that goes over the expenses for the streets and the revenue every year, so just keeps going down every year, unfortunately.
Have a roll call?
Young,
Aye.
Covert,
Aye.
Crowner,
Aye.
Johnson,
Aye.
Lees.
Aye. Motion carried. Item number 4 is to approve a resolution accepting Phase 2 of the Gear Avenue Trail project and release of retainage in the amount of $30,000.
Motion to approve.
Support.
Motion with support. Any questions, comments, concerns?
I have a question. Will this will finish the project done, last step?
Yes.
Yes.
Yep.
Chase, how do you feel about that?
Nothing's really changed over there since I started really, so it's just been back and forth, so.
All right, thank you.
Biggest project is getting the DOT to finish up all of their audit and stuff, so that's what's completed now, so.
Thank you.
Roll call?
Covert,
Aye.
Crowner,
Aye.
Johnson,
Aye.
Lees,
Aye.
Young.
Aye.
Motion carried. Item number 6 is to consider a resolution authorizing the filling of an application for the Iowa Department of Transportation's Federal Recreational Trails Program for the construction of the agency road trail.
So moved.
Support.
Motion with support.
Make just a quick comment, because you see me vote no against these, and then sometimes people call me afterwards and wonder why, and it's not that I'm against the trail, it's just I would rather do other things first. So I would rather connect people down through Broadway, out to the Recplex and down to that trail system there before this one. Something I hope we get and I hope we do someday, but it wouldn't be near the top of my list. So that's why you see that. Thank you.
Just to add to that, because I think there's more foot traffic on Agency than Broadway to the Recplex at this time.
Yeah, because your odds of getting hit walking that way are pretty rough, so I wouldn't walk it either.
I just want to make, I'm glad you said that, Andy, because I always wanted to know why.
Yeah.
And I look at it as a part of the improvement for our college, because I know you're really big on a college. And if our students at that college say, hey, they got an easement walking, it's easy walking instead of walking the street, that's how I sort of look at it besides the students, and people going to the hospital. But thank you very much for saying the reason why.
And really, that's one of those cases, I wish we'd do just a sidewalk and do an assessment to those 3 or 4 businesses, and we'd still end up paying like half that. But that's what I would rather do in that location, so that's it.
Anything that we can have to improve the safety of people walking alongside that road, I'm for it.
Well, when I
And
see,
to add to that,
I see people in their motorized wheelchairs going down the side of the road to get to the hospital for their appointment, it's kind of like,
Even in the winter.
yeah. Broadway's next.
just to
John,
add
did you
to it,
think?
I have had multiple close calls on Agency. I've never had them on Broadway or anywhere else going to the Rexplex. So,
I've just had the opposite experience.
yeah. So, someday I might be in that wheelchair, but I'll have a go-kart motor on mine.
Can I push? Okay. All right, any other comments? All right. Roll call, Kelly.
Crowner,
No.
Johnson,
Aye.
Lees,
Aye.
Young,
Aye.
Covert.
Aye.
Motion carried. And we'll finish up with item number 7, consider resolution.
This is 6, tap.
Hiring a part-time officer for the
Wait
police
a second,
department.
we missed one. We did the,
6.
we just need to do the,
We just did 5.
Okay. Number 6.
actually, I think we did the federal trail, recreation trail. I think we skipped 5, actually. We need to do the resolution approving
Because
the
we did the
tap.
federal, we need to do the state.
Yeah.
So we'll go back to 5 and consider the resolution authorizing the filling of an application for the Iowa Transportation Alternative Set-Aside Program for construction of the agency road trail.
Motion.
And support.
Okay. And I'm sure the comments are still the same from
Yep.
item 6, so roll call.
Johnson,
Aye.
Young,
Aye.
Lees, sorry,
Aye.
Covert,
Aye.
Crowner.
No.
Okay, motion carried. Okay, now we'll mosey to number 7. It's consider resolution hiring a part-time officer for the police department.
Motion to approve.
Second.
Second, any questions or?
Just one. Is she going to be involved in the media again?
Yes.
Okay. I asked if she was going to be involved in our media programming again. So that's, I think it's improvement then and
Yes.
helpful.
It's kind of like welcome back Cotter, isn't it?
Right? It is.
Well, glad to have her back. Any
Yes.
other questions or comments?
Missy's a good officer and glad she's back, even if it's part-time.
Roll call.
Lees,
Aye.
Young,
Aye.
Covert,
Aye.
Crowner.
Aye.
Johnson,
Aye.
Motion approved. Item number 8 is to consider a 3-year contract to switch RMM providers from ConnectWise to, I'm going to screw it up, Kaseya's Business Management Suite. And Brad's going to tell me all about this.
Motion to approve.
Support.
Motion with support. Now, comments, Brad?
Alrighty, but essentially, ConnectWise wanted to raise their fees 10%, so I put the poll out there. Kaseya is going to come in way under. It's my RMM software. It allows me to be here when I can't be, essentially. It also allows me to do workflows to fix things without me having to be here. So basically, we're just replacing one software with another at less money.
Good job, Brian.
And we're saving how much money, did you say?
I should have it on my ROA sheet there real quick.
Should
if you
have this
wanted to look.
memorized.
I should have brought it
Net
up.
savings of $3,183 over the 3-year period.
Okay.
And also, I didn't put in the memo, but the fees for the overage this year will come out of my training budget because it is for training. It's training on the software. That's why it's more this year than next year and the following year.
And it's a budgeted item?
My training is, yes.
Okay. Do we have to do a roll call on this one? Oh. Any other questions or comments? All those in favor, say aye.
Aye. Aye.
Opposed? All right. Motion approved. We're down to the citizens' inquiries. If we have anybody that would like to address the council.
Were you wanting to bring back up the slide item? Did you just, were you removing it or were you moving
We
it on?
pulled it all together.
Okay,
I think Chase is gonna go get some more.
Bring something else back.
Gotcha.
Teresa, I think you did a very good job of telling everybody to get out of here.
Yeah, There's just
So
no
there's
sense
no
in them
inquiry.
waiting for them to buy me a drink
I know.
later. Sometimes they feel committed to stuff that to sit here for the rest of the meeting. And sometimes, you know, there's some council member that does drag on a conversation. But we love them.
Maybe both of us, I don't know.
I shouldn't have said nothing, should I?
I'll take a motion to adjourn.
So moved.
Support.
All those in favor say aye.
Aye.
Oh, we're adjourned.
Thank you.